Welcome, everyone. Today, we're going to explore the fascinating world of medical terminology. As we delve into this topic, I encourage you to ask questions and engage with the material. Let's start with the basics of medical terminology. Every medical term is composed of three key components: the prefix, the root word, and the suffix. The root word is the core part that carries the essential meaning of the term, usually referring to a body part or system. The prefix and suffix modify the root word, giving you information about location, time, amount, or condition. For example, take the word cardiology. The root word here is cardio, which refers to the heart, and the suffix logi means the study of. So, cardiology is the study of the heart. Once you understand these basic components, you'll be able to break down and understand thousands of medical terms. Now, let's talk about anatomical directions, planes, and positions, terms that help healthcare professionals describe the exact location of structures or conditions in the body. Picture the body in anatomical position, standing upright, facing forward, with the arms at the sides and palms facing outward. This is the standard position used to avoid confusion when describing directions or locations. In this position, medial means closer to the midline of the body, while lateral means farther from the midline. Proximal refers to something closer to the origin of a body part, like the shoulder being proximal to the hand, and distal means farther from the origin. If we're talking about the front of the body, we use the term anterior or ventral, and posterior or dorsal refers to the back. Moving on to body planes, the transverse plane divides the body into upper and lower sections, while the sagittal plane splits it into right and left halves. Understanding these directions helps healthcare providers communicate clearly about a patient's condition or injury. Let's move on to the digestive system. We have words like gastroscopy, which refers to a procedure used to visually examine the stomach, and colonoscopy, which is a procedure used to visually examine the colon. We also have terms like gastrectomy, which refers to the surgical removal of the stomach, and colostomy, which is a surgical procedure that creates an opening in the colon to divert waste. Now, let's discuss the cardiovascular system. We have words like arterial, which refers to the arteries, and valvuloplasty, which is a surgical procedure used to repair a valve in the heart. We also have terms like pericardium, which is a double-walled membranous sac that encloses the heart, and electrocardiogram, which is a test used to measure the electrical activity of the heart. Let's move on to the respiratory system. We have words like tachypnea, which refers to rapid breathing, and dyspnea, which refers to difficulty breathing. We also have terms like pneumonia, which is inflammation of the lungs, and bronchiectasis, which is a disorder of the bronchi that causes them to become wide and infected. Let's also discuss the blood system. Hematology is the study of blood, and hematologists focus on diagnosing and treating blood disorders. The blood contains erythrocytes, red blood cells, which carry oxygen, leukocytes, white blood cells, which fight infections, and thrombocytes, platelets, which help with blood clotting. Any abnormalities in these components can lead to conditions like anemia, infections, or clotting disorders. Now, let's discuss the urinary system. We have words like pyelonephritis, which is inflammation of the kidney, and diuresis, which is increased excretion of urine. We also have terms like nephrosis, which is a disease of the kidney, and hydronephrosis, which is a condition where the kidney becomes enlarged due to obstruction of the urine flow. Let's move on to the nervous system. We have words like neurectomy, which is a surgical procedure used to remove a nerve, and neuroplasty, which is a surgical procedure used to repair a nerve. We also have terms like hydrocephalus, which is a condition where there is an abnormal accumulation of cerebrospinal fluid in the brain, and electroencephalography, which is a test used to measure the electrical activity of the brain. Now, let's discuss the muscular system. We have words like fasciitis, which is inflammation of the fascia, and tendinitis, which is inflammation of the tendons. We also have terms like myolysis, which is degeneration or breaking down of muscles, and myomalacia, which is abnormal softening of muscles. Let's move on to the reproductive system. We have words like menstruation, which is the normal discharge of blood and tissue from the uterus, and amenorrhea, which is the absence of menstrual periods. We also have terms like dysmenorrhea, which is painful menstruation, and menorrhagia, which is excessive menstruation. Now, let's discuss the skin. We have words like erythroderma, which is a condition where the skin becomes red and inflamed, and dermatitis, which is inflammation of the skin. We also have terms like melanocytes, which are cells that produce melanin, and leukoderma, which is a condition where there are white patches on the skin. Finally, let's talk about medical specialties. We have doctors who specialize in various fields, such as dentistry, internal medicine, and psychiatry. We also have specialists like urologists, who diagnose and treat diseases of the urinary system, and neurologists, who diagnose and treat diseases of the nervous system. In conclusion, medical terminology is a complex and fascinating field that requires a deep understanding of the components of medical words, anatomical directions, and medical specialties. I hope this presentation has provided you with a comprehensive overview of medical terminology and has sparked your interest in this field. Thank you for your attention, and I welcome any questions you may have.